Your TSH is in range, but that doesn't mean it's optimized for pregnancy, and underlying immune issues can still interfere with getting and staying pregnant. Most women are told their thyroid is fine and still end up with miscarriages. I'm going to show you exactly what's missed and what to test so it doesn't keep happening. I'm Dr. Cindy. My husband, Dr. Cody, and I are the doctors behind Fertility for Two. We help couples get pregnant naturally. When it comes to thyroid and fertility, most testing stops at TSH. If TSH falls within standard lab range, you're told your thyroid is fine. But TSH is just a signal from the brain to the thyroid. It does not tell you how well thyroid hormone is being produced or how efficiently T4 is being converted into its active form, T3, or if the immune system is attacking the thyroid. And that last piece, autoimmunity, is one of the most commonly missed factors in fertility. You can have a normal TSH, normal T3, and normal T4 and still have an immune system that may be interfering with implantation and early pregnancy. Thyroid antibodies are markers that the immune system is reacting to the thyroid, specifically thyroid peroxidase antibodies and thyroglobulin antibodies. This matters for fertility for a few reasons. First, it reflects a heightened immune state. Think of this as a smoke alarm. It's signaling that your immune system is reacting to something in your body, which can affect things like implantation, early embryo development, and the body's ability to maintain a pregnancy. Second, an optimized thyroid cascade is critical for egg development, endometrial receptivity, and early embryo development. So even subtle disruptions, especially in the presence of autoimmunity, can increase the risk of miscarriage. And this is where it gets missed over and over again. This is the case for a client of mine. Stephanie was given the diagnosis of secondary unexplained infertility, meaning that she has a healthy 3-year-old but was struggling to get pregnant again. When we met, Stephanie and her partner Lucas had been trying for their second for about 13 months. And they had experienced 3 miscarriages, all before 8 weeks. Her basic labs were normal, TSH was within range, so she was told to just keep trying. She was eating a whole foods diet, taking prenatals, and tracking her cycle. She was doing everything right and still losing pregnancies. But when we ran a more complete workup, her thyroid antibodies were significantly elevated. That told us that her immune system was active, not necessarily destroying her thyroid function yet because her thyroid was able to compensate well, but this may have been creating an environment that wasn't stable enough to support early pregnancy. We focused on calming that immune response and supporting her thyroid. So over time, her antibody levels started to come down, and so did her nervous system. For her, the worst part about the whole process before working with us was the lack of clarity. She had no one to thoroughly investigate what was going on. Having direction and focus alone can relieve so much anxiety about the process of trying to conceive. Now, we did an extensive investigation and narrowed down the exact area that needed attention. We focused on supporting the environment and creating a safe space so conception can occur, and pregnancy is carried to term. Stephanie is currently 31 weeks pregnant as I record this video. If you're trying to conceive or dealing with recurrent miscarriages, this is where most workup falls short. So here's what exactly needs to be tested: TSH, free T4, free T3, reverse T3, TPO antibodies, and thyroglobulin antibodies. That gives a much more complete picture of thyroid function and immune activity. Because without antibodies, you're missing a major piece. And if antibodies were elevated, the goal is to reduce immune activation and support the system. Testing is step 1. What you do with that information is what actually changes the outcome. And this is where the conventional model falls short. These are some of the highest impact areas for thyroid and fertility specifically. First is blood sugar stability. Large swings in blood sugar increases cortisol, which directly suppresses thyroid function and reduces conversion of T4 to active T3. Over time, that creates a lower functioning metabolic environment, even if your labs look normal. So focus on eating whole foods, including protein with each meal and reducing refined carbs like pastries, candies, or sodas. Second is nutrient support. Thyroid health and immune function rely on key nutrients like selenium, zinc, iron, and vitamin D. But don't just guess your way through this. These should be tested and retested sometime after starting supplementation. Third is sleep and circadian rhythm, because poor sleep increases immune activation. You want a consistent sleep schedule, morning sunlight exposure, and minimal light at night. Don't graze all day. Eat at meal times to get your internal organs into a consistent rhythm. Fourth is reducing immune triggers. This can include eliminating gluten or dairy for some, avoiding highly processed foods, and reducing chronic stress. The goal is not perfection. All we're trying to do is reduce the total inflammatory load so your body has a chance to rest and recover. Fifth is to support thyroid conversion and metabolism. Even with a normal TSH value, poor conversion of T4 to T3 can affect function. This ties back to liver health, gut health, and nutrient status. The key takeaway is this. A normal TSH does not mean that your thyroid is functioning optimally for fertility, and it definitely does not rule out immune involvement. So if antibodies are elevated, that's just a signal, and it's one that often gets ignored until multiple losses have occurred. In my opinion, one loss is already too many. A structured investigation can make a huge impact on your family's future, and you don't have to wait for permission to start digging. In the Fertility for Two program, we don't stop when labs fall within range, because normal doesn't mean functional, and it doesn't mean fertile. We're asking questions like, what's your body actually doing? What signals are being sent? And what environment is being created for pregnancy? So if you've been told that everything looks normal, but you're still not getting pregnant, or you're experiencing recurrent losses, something is being missed. We specifically designed the Fertility for Two program to help couples identify and address the root causes of infertility. So if you're ready for a structured plan, apply to work with us through the link below. From our family to yours, have a fertile day.